thank you, Adam, for inviting me as co-chair of the All-Party Parliamentary Group on HIV and AIDS to provide this message at today's workshop. Before I start, I'd just like to say some words about our All-Party Group. Since 1986, the All-Party Parliamentary Group on HIV and AIDS has brought parliamentarians together from across the political spectrum to fight for the rights of people living with HIV and ensuring everyone has better access to testing and HIV prevention methods. HIV, as we all know, is not yesterday's story. It is with us today in the UK and affecting families all over the world. The All-Party Group believes that as parliamentarians, we should play our part in addressing this epidemic. In particular, we have an important role in ensuring that laws and policies are respectful of human rights and promote public health. We value highly the advice, guidance and support that we get from people living with HIV, NGOs and professionals outside of Parliament. We try and increase the dialogue between politicians and people living with HIV in the UK and around the world. In July 2019, I was excited to join the HIV Commission launched by the Terence Higgins Trust, National AIDS Trust and the Elton John AIDS Foundation. As a former Public Health Minister, this is an issue I am passionate about. The HIV Commission developed evidence-based recommendations that are now the foundations of the HIV Action Plan. In December of last year, on World AIDS Day, the UK Government 2020 HIV Action Plan proposed to reduce new HIV transmissions to zero by 2030. We understand that there are approximately 5,000 people still diagnosed with HIV each year, and better access and understanding of PrEP is needed if we're to end new transmissions of HIV by 2030. Now, before I go into the arguments about better access to PrEP, let me paint a picture on how we got here. In England, PrEP has been available routinely and for free through our fantastic National Health Service for just over a year, about 2 years. Prior to that, PrEP was available through a clinical trial called the Impact Trial that made PrEP available for free in England to 25,000 people and to buy online privately. It's estimated there are around 45 to 50,000 people in the UK right now who are currently taking PrEP or who have taken it. Almost all the people in the UK who use PrEP are gay and bisexual men, disproportionately white, living in major urban areas. We believe that HIV incidence in gay and bisexual men in the UK has fallen to such an extent that the fall in diagnoses among heterosexuals exceeded those in gay and bisexual men for the first time in a decade in 2020. The fall in diagnoses in men is in large part a result of the growing availability of PrEP. There is a lot more work to do to increase PrEP awareness to some of the other groups of people who could benefit from it. We urgently need to see greater public awareness, raising efforts and health promotion campaigns, improving knowledge and understanding of PrEP in different communities. We also have to ensure staff are trained, supported and confident to initiate conversations and offer PrEP to all groups who may have higher HIV risk. As well as changing knowledge and understanding about PrEP, we have to make sure that it is available within those settings that those people ordinarily use. For example, we know Black African women, who are one of the groups who are disproportionately impacted by HIV, are much less likely to seek their sexual health care from a sexual health clinic. Instead, they're much more likely to seek that care from their family doctors. And yet, right now, PrEP is not widely available from GP centres or our primary care providers. Great efforts have been made to test all women for HIV through maternity services and community-based testing, going out to reach communities directly. But the way the system is designed, PrEP cannot be offered in these settings either. We're hoping that's going to change. We're also hoping that the government, through the implementation of the HIV Action Plan, can look at ways that PrEP can be available from pharmacies, from chemist shops, not necessarily all of them, but some that will be able to offer a specialist service, making PrEP much more available from a high street setting rather than from sexual health services that right now often have long waiting lists and long waiting times. More and more people are now accessing HIV testing online, testing themselves at home. There must be ways of combining these services with PrEP monitoring and an e-PrEP offer in the future, where it could be delivered with their tests or picked up from a nearby pharmacy. The action plan committed to, quote, a drive to innovation in PrEP delivery to improve access for key groups, including provision in settings outside of sexual and reproductive health services. This plan and its subsequent implementation is needed as a matter of urgency. The next 6 months is a real opportunity to set us on the right track to achieve our joint aim of ending new HIV transmissions by 2030. The All-Party Group, along with the HIV sector, will be holding the government to account on their actions in the HIV Action Plan to reduce new transmissions by 2025 and then 2030. One way of doing this will be for better access to PrEP outside of sexual health settings and outreach to let those at risk of HIV that is available. Thanks for taking the time to listen to us. If you'd like to know more about the All-Party Group, then contact our Senior Policy Advisor, mark.lewis@parliament.uk, and you can find us on Twitter, All-Party Group HIV AIDS.